The next one and the last nerve plexus we'll deal with is the sacral plexus. So the sacral plexus, we already dealt that it supplies the skin and muscles of the pelvis and the lower limb, and it is located in the posterior pelvic wall, posterior pelvic wall, and anterior to the piriformis muscle, anterior to the piriformis muscle. The formation. This plexus is formed by the anterior divisions of the sacral spinal nerves, that is S1, S2, S3, and S4 also occasionally, and also receives contribution from L4 and L5. So root value is L4 to S3 or sometimes S4. There is something called high sacral plexus and the low sacral plexus. Usual form of sacral plexus is L4 to S3. Sometimes it is situated, the nerve roots are formed from a higher portion. That is, it can come from L3 onwards also. That is, it can come from L3 to S2. That is called as high form of sacral plexus. Now, the lower form is from a level below. That is L5 to S4. That is why in some books we can see that S4 is also involved in sacral plexus formation. The usual form is this one, L4 to S3. We'll deal only with the usual form. Now these sacral plexus, these have nerves which remain in the pelvis and also the ones which leave the pelvis via the greater sciatic foramen. The ones that leave the greater sciatic foramen enters the gluteal region of the lower limb and innervates the structures there and below. The ones that remain in the pelvis innervate the pelvic muscles, organs, and the perineum. Now we'll deal with the branches. This one we already said, it lies between the piriformis muscle and the pelvic fascia, and it is located in the posterior wall of the pelvic cavity. It innervates the pelvis, the buttocks, the genitals, the thighs, calves, and feet. And the root value. Now coming to the branches of sacral plexus. We'll deal with sciatic a little bit later. We'll first deal with the other branches. First one is superior gluteal nerve. Superior gluteal nerve leaves the pelvis through the greater sciatic foramen. And then it supplies the gluteus minimus, medius, and the tensor fasciae latae muscle. Gluteus medius, gluteus minimus, and tensor fasciae latae muscles are innervated by the gluteal nerve, superior gluteal nerve. The root values L4, L5, and S1. There are no sensory supply from the superior gluteal nerve. Next one is the inferior gluteal nerve. Inferior gluteal nerve also leaves via the greater sciatic foramen and it supplies the gluteus maximus muscle. This also does not have any sensory supply. It is only purely motor nerve. This supplies the gluteus maximus muscle and the root value is L5, S1 and S2. The reason behind being called superior and inferior gluteal is because superior gluteal muscle leaves the greater sciatic foramen superior to the piriformis muscle and inferior one goes inferior to the piriformis muscle. That is the difference. So, superior gluteal supplies the gluteus medius, minimus, and tensor fasciae latae. Inferior one supplies the gluteus maximus muscle. And now, coming to the posterior cutaneous nerve of the thigh, also called as posterior femoral cutaneous nerve. This also leaves via the greater sciatic foramen and then supply. It is a purely sensory nerve. Okay, this supplies the buttocks, the uppermost medial and posterior surface of the thigh. The cutaneous branches to the buttocks and the uppermost and medial and posterior surface of the thigh. It also has a it also gives off branches, cutaneous branches to the perineum. So that was the femoral cutaneous branch, posterior cutaneous nerve of the thigh. The next important one is udental nerve. Udental nerve also leaves via the greater sciatic foramen, but it re-enters via the lesser sciatic foramen. It leaves the greater sciatic foramen, leaves through the greater sciatic foramen and re-enters via the lesser sciatic foramen. The root value is S2, S3 and S4 and it gives off branches to the skeletal muscles in the perineum. Skeletal muscles in the perineum, muscles of this perineum and muscles, that is the external urethral sphincter and the external anal sphincter and levator ani. It gives off branches to the skeletal muscles of perineum, levator ani and majorly to the external urethral sphincter and the external anal sphincter. That is why whenever there is an injury to the spinal cord at the level of S2, S3, S4, there is issue, incontinence or retention in the urine because of the paralysis of the external urethral sphincter. That was about the pudendal nerve. Next, we'll deal with the most important nerve of the sacral plexus, which is the sciatic nerve. The root value is L4 to S3, L4, L5, L4, L5, S1, S2, S3. Now, this sciatic nerve has two parts. One is tibial portion, the other one is fibular or peroneal portion. Tibial portion and peroneal portion. Peroneal portion is also called as common fibular portion. This peroneal also again divides into deep peroneal and superficial peroneal. Deep and superficial peroneal. Now, in a gist, the motor functions of sciatic nerve are it innervates the muscles of posterior thigh. That is the biceps femoris, semimembranous, and semitendinous muscle. The sciatic nerve, it has two portions, tibial and peroneal or common fibular portion. The functions of sciatic nerve, first we'll deal with the motor. It innervates the muscles of the posterior compartment of the thigh. Those are the biceps femoris, then the semimembranous semi-tendinous. Together they are called the hamstrings. Now this biceps has a short head and a long head. Short head and a long head. The long head is supplied by the tibial nerve. The short head is by the peroneal nerve. Hmm. And other muscles are the hamstring portion of the adductor magnus. This adductor magnus is a large muscle. It has two portions. One is the adductor portion and another one is the hamstring portion. Adductor portion is supplied by the obturator nerve. This one is by the sciatic nerve. Now, coming to the sensory function, there are no direct sensory functions. So, this sciatic nerve gives off terminal branches. Terminal branches, which then later supplies the gives off the cutaneous, which then gives off the cutaneous branches, and supplies the skin over the lateral leg, heel, and both dorsal and plantar aspect of foot. These are the functions, motor and sensory, in a gist of the sciatic nerve. Now we'll deal with tibial one and the peroneal nerve one and differently. Coming to the tibial nerve. Tibial nerve has a root value, just like the sciatic nerve, it has root value L4 to S3. L4 to S3. This one arises from the apex of popliteal fossa. The apex of popliteal fossa arises and travels through the popliteal fossa and gives off branches to the superficial posterior compartment of the leg. Here, it gives off one branch called sural nerve. Sural nerve, which innervates the posterolateral aspect of the leg. Sural nerve innervates the posterolateral aspect of the leg. Then it continues downwards and passes posteriorly and inferiorly to the medial malleolus. Posteriorly and inferiorly to the medial malleolus. And it goes through a structure called tarsal tunnel. Then it gives off the cutaneous innervation to the heel and it terminates by dividing into sensory branches to the sole of foot. That is the course of tibial nerve in a chest. Now we'll go to the motor functions. Motor functions of the tibial nerve. So this Tibial nerve innervates all of the posterior compartment of the leg. All of the posterior compartment of the leg is innervated by the tibial nerve. So these are the muscles in the posterior compartment of the leg. We'll deal with the deep ones first, then the superficial one. Deep muscles are the popliteus, then flexor hallucis longus, flexor digitorum longus, tibialis posterior. These are the deep muscles which are innervated by the tibial nerve. Now coming to the superficial, the ones innervated are the plantaris muscle, soleus, and the gastrocnemius. These are the superficial muscles innervated by the tibial nerve. These are the ones. Next one is the sensory. Sensory branches of the tibial nerve are medial calcaneal branch, which supplies the skin over the heel. Next one is the medial plantar nerve, which supplies the plantar surface of medial 3.5 digits. And the last one is the lateral plantar nerve. That supplies the plantar surface of the lateral 1.5 digits. These are the sensory supply and the motor supply of the tibial nerve. This sensory branches of the tibial nerve combine with the branches of fibular nerve to form the sural nerve. The tibial branch and the peroneal branch combine to form the sural nerve, which supplies the posterolateral aspect of the leg. So these are the things about tibial nerve. Next one is the fibular nerve. Next one is fibular nerve. The common fibular nerve has a root value same as that of a sciatic nerve, that is L4 to S2. Not same, S2 it is, not S3. S3 is involved in the formation of tibial nerve. So this innervates the short head of biceps femoris, in the thigh, and gives off the branches to the lateral and anterior compartment of leg, and also has sensory branches which supplies the lateral leg and dorsum of foot. The plantar aspect of the foot was by the tibial nerve. The dorsum is by the fibular nerve, common fibular nerve. Now, the motor functions. This common fibular nerve or common peroneal nerve gives off two branches, superficial peroneal and deep peroneal, which supplies the structure superficially and deep. Now, the superficial peroneal nerve gives off branches to innervate motor branches to innervate the lateral compartment of the leg. That is, the muscles of the lateral compartment of the leg are fibularis longus and brevis. There is peroneus longus and brevis. Peroneus longus and brevis, also called as fibularis longus and fibularis brevis. These are the muscles of the lateral compartment of the leg, which is supplied by the superficial peroneal nerve. And then these are the everters of the foot. Now, this was about the superficial peroneal nerve. Next one is the deep peroneal nerve. Deep peroneal nerve gives off branches to the anterior compartment of leg. These muscles are tibialis anterior, extensor digitorum longus, extensor hallucis longus. Also, it gives off some branches to the intrinsic muscles of foot. Also gives off branches to the intrinsic muscles of the, namely the extensor digitorum brevis and extensor hallucis brevis. These are the two intrinsic muscles of the foot which are supplied by the deep peroneal nerve. The superficial peroneal nerve supplies the lateral compartment of the leg, that is fibularis longus or peroneus longus and brevis, and the deep one supplies the anterior compartment of the leg. The muscles are tibialis anterior and extensor digitorum longus and extensor hallucis longus. And there is one more muscle called fibularis tertius or peroneus tertius. It is also supplied by the deep peroneal nerve. Next one is the sensory supply. Sensory supply is through the sural nerve. As we said earlier, the tibial nerve, cutaneous fibers combine with the peroneal nerve sensory fibers and form the sural nerve, which supplies the lower posterolateral aspect of leg. Lateral aspect of the leg. And there is another nerve called lateral sural nerve. Lateral sural cutaneous nerve, which supplies the upper lateral aspect of leg. These are the two sensory branches, sural communicating nerve and lateral sural nerve, which supplies the posterolateral and the upper lateral aspect of the leg respectively. Other than that, the superficial peroneal and deep peroneal also has its own sensory innervations. Superficial peroneal nerve supplies the anterolateral. Superficial peroneal nerve supplies the anterolateral aspect of the leg, anterolateral aspect of the leg, and also dorsum of foot, except the skin between the first and second toe. Except the skin between the first and second toe, all the other portion of the dorsum of foot and the anterolateral aspect of the leg is supplied by the superficial peroneal nerve. Now, the deep peroneal nerve is the one that supplies the skin between the first and second toe, the dorsal aspect. Deep peroneal nerve supplies the skin between the first and second toe, the dorsal aspect. This was about the sciatic nerve. Now, the clinical anatomy of sciatic nerve is in case of fracture of fibula or in case of some plaster which is bound on the leg, it can cause injury to the common fibular nerve because this common fibular nerve is comparatively a superficial nerve. So it is liable to injury. So this can cause the paralysis of all these muscles, which in turn leads to the condition called foot drop. Condition called foot drop. That is an important aspect of the fibular nerve, common fibular nerve. That was about sciatic nerve. Now we'll deal with the other branches of sacral plexus. We dealt with sciatic nerve, superior gluteal, inferior gluteal, posterior cutaneous nerve of thigh, udental. Now we'll deal with nerve to quadratus femoris. Nerve to quadratus femoris is a smaller branch of sacral plexus. It supplies the quadratus femoris muscle and the inferior gemellus muscle. The root value is L4, L5 and S1. The other nerves are nerve to obturator internus and superior gemellus. As the name suggests, it supplies obturator internus and superior gemellus muscle. The root value is L4, S1 and S2. Next one is nerve to piriformis, supplies the piriformis muscle. Root value is S1 and S2. The next one is perforating cutaneous. S1, S2 is the root value. This is a cutaneous branch, as the name suggests. It supplies the medial part of the buttocks or gluteal region. Next one is the pelvic splanchnic nerve, which takes part in the inferior hypogastric and pelvic plexus. There is an extra smaller nerve which supplies to the levator ani and coccygeus muscle. This was about sacral plexus. We go over once again. It is located in the posterior wall of pelvic cavity between the piriformis muscle and the pelvic fascia. It supplies, the root value is L4 to S3. It innervates the muscles and the skin over these regions. The major nerve which arises from the sacral plexus is the sciatic nerve, the udental nerve, the superior and inferior gluteal nerve, and the posterior cutaneous nerve of the thigh. Sciatic nerve has two branches, the fibular branch and the tibial branch, which supplies the hamstrings, the posterior compartment of the leg, the lateral compartment of the leg, and the sole and the dorsum of foot, and also the skin over these regions. The superior gluteal nerve supplies the gluteus medius, minimus, and the tensor fasciae latae muscle. The inferior gluteal nerve supplies the maximus muscle. The posterior cutaneous nerve of thigh, it is a purely sensory nerve, supplies the skin over the buttocks and the uppermost medial and posterior surface of the thigh. Udental nerve is an important one. It leaves the greater sciatic foramen and re-enters via the lesser sciatic foramen. It supplies the skeletal muscles of the perineum and the external urethral sphincter and anal sphincter. And the other nerves are Quadratus femoris, nerve to quadratus femoris, which supplies the quadratus femoris, nerve to piriformis, which supplies the piriformis, perforating cutaneous, which supplies the skin over the medial part of the buttocks, then the pelvic splanchnic nerve, which gives off branches to the inferior hypogastric and pelvic plexus, which innervates the pelvic viscera. Then the nerve to levator ani and the coccygeus muscle. This was about the spinal nerve plexus of the human body. And yeah, we dealt with the cervical plexus, brachial plexus, lumbar plexus, and sacral plexus.